The leading doctors in Navan, the GPs there, all saying that the emergency department there is not safe. Why are you not accepting their word for that?
Well, first of all the doctors and the clinicians in Navan Hospital have not said that. That's not true. And actually today we've had a letter which is like a bombshell from 17 ED and other consultants in Drogheda, which basically leaves the plan by the HSE in tatters, because what that letter practically says is that senior management in the HSE are wrong. That senior management in the HSE are actually going to do damage to patient health, and that they don't have the resources to deal with the situation that's happening in Navan. What they're practically saying is that the HSE is seeking to shift risk from Navan into Drogheda. And all we're asking to do in the Safe Navan Hospital campaign is asking the HSE not to shift the risk, but fix the risk.
Okay,
and the way to fix the risk is to invest in the surgery services that are absent in Navan.
Okay, we can understand why you might seize on this letter, but what those consultants actually say in that letter is that the emergency department in Navan is unsafe. They say it categorically.
And why is it unsafe? Because Colm Henry and other senior management in the HSE closed the acute surgical surgery services in Navan 10 years ago. Afterwards, there was a patent report carried into that action which said that that decision was without foundation in terms of safety. So the actual HSE management have created the damage in Navan A&E that now they say they're trying to fix, but they're not trying to fix it by restoring it. They're trying to fix it by sending 25,000 people from Navan A&E into Drogheda, which is already jointed.
Yeah.
And, you know, it's just so unbelievably hard to understand that we can have a capacity crisis in A&E throughout the region, and yet the HSE response is to take more capacity out of A&E.
The reality is this. It sounds like politicking. The reality is that the clinical director of Our Lady's Hospital in Navan went on drive time this evening. We heard from him in Rita's package as well, Jerry McEntee, and he said inevitably there will be fatal outcomes if the situation continues in Navan as it is. Are you, as a politician campaigning on this, willing to take responsibility for what could happen?
Well, the only way to prevent fatal outcomes is to invest in acute surgery services. And everybody that we have spoken to have said that that would resolve the issue. And let me tell you, like, the governments are talking about their alternative pathway being a GP referral MAU, medical assessment unit. Now, on what planets do the HSE live on if they think that a person who is in an emergency can ring a GP who are as rare as hen's teeth, whose appointments can take up to 2 weeks to get,
if they're in an emergency,
and wait for a referral from that GP to go to an MAU, they're simply not going to do that. They're going to end up in Drogheda. And this is really...
They'll call 999 if they're in an emergency, and they'll be brought to a centre of excellence in Drogheda. Isn't that what this is about? Providing a standard of care which can save lives.
First of all, right, Fran, we don't have centres of excellency in this country. We have centres of trolleys. And it's really important that we start to frame this crisis as it is. The health service is in an enormous disaster zone at the moment. We have record waiting lists, 24-hour waiting times in Tallaght. We have the Mater Hospital on one side of us and Mullingar Hospital on the other side of us, telling patients not to attend their A&E. Such is the level of crisis. We have a staff in Connolly Hospital out on a picket due to the level of overcrowding here. It is just incomprehensible that the HSE management are divorced from this reality in which the citizens of this country have to exist in. And the fact that we cannot have a conversation on Navan Hospital without dealing with the crisis in overcrowding elsewhere. And the Irish Emergency Hospital Associations, they have said that 350 people die every year in this country due to overcrowding in A&Es. That needs to stop, and we're going to fight for our A&E.
Peadar Tóibín, there we leave it. Thank you for joining us from Navan.